Hello. The newspaper articles that I'm going to talk to you about today are about the tragic story of a 19-year-old university student who died from anorexia in 2012 and the outcome of the month-long inquest into her death 8 years later, which concluded on Friday the 6th of November 2020. The articles are from the Daily Mail, the Guardian, the Gazette and the East Anglian Daily Times. I'm Dr Beth Colby, a registered medical practitioner and psychiatrist in London. Averil Hart was a bright student and had a black belt in karate. She was diagnosed with anorexia nervosa when she was around 16 years of age. Prior to starting a degree at the University of East Anglia in 2012, Averil spent 11 months at an eating disorders unit at Addenbrooke's Hospital. Tragically, she died 10 weeks after she started university. In Averil's first term at university, she was under the care of the Norfolk Community Eating Disorders team. Due to staffing levels, she was assigned an inexperienced trainee psychologist as her key worker. During her weeks at university, she lost weight and was found collapsed in her flat on the 7th of December and was taken to hospital by ambulance. She spent 4 days at the Norfolk and Norwich University Hospital and, despite being in a severely malnourished state, was not given adequate nutrition. Her stay included a weekend. She was then transferred to Addenbrooke's Hospital in Cambridge, but sadly died 4 days later on the 15th of December 2012. The Cambridgeshire and Peterborough Assistant Coroner Sean Horstead recorded her death as from anorexia. He concluded that Averil's death could have been avoided and was contributed to by neglect. He outlined a series of failings in her care. These included a lack of commissioning services for the medical monitoring of patients with anorexia nervosa who were at high risk of relapse. There was a missed opportunity a week before Averil's admission to hospital when her father expressed his concern about her health, but he was not spoken to by a member of the Norfolk Community Eating Disorders team. He said that in the context of her severely malnourished condition, the failure to give adequate nutrition was a gross failure which had a direct connection with and contributed to her death. There was a lack of support from psychiatrists and dietitians at the weekend on the ward that she was admitted to, and also a failure to manage her anorexic behaviours like getting out of bed and walking, which led to her falling and hitting her head. Nick Horstead said that he would write to the Royal College of General Practitioners and the Royal College of Psychiatrists with concerns over education and training. He said that anorexia nervosa has the highest mortality of any mental health condition. Prior to the month-long inquest into Averil Hart's death, Sean Horstead oversaw 4 other inquests back-to-back of women who had died from anorexia nervosa between the years 2012 and 2018. They were all under the care of Cambridgeshire and Peterborough NHS Foundation Trust. He identified similarities between all the cases and has written a Prevention of Future Deaths report and said that he would write to organisations such as NHS England to express a series of concerns. There is a hope that the tide can be turned, he said. I hope that the 5 inquests in this jurisdiction will be the start of that. Thank you for listening. Bye for now.